Fantastic. And again, good evening. It is my pleasure to welcome everybody to this evening's Diagnostic Medical Sonography Program info session. We are joined today by Professor Corey Finn, the director of our DMS program, as well as members of the faculty of this program. We are so excited that you chose to join us this evening, and we do hope that everybody is doing well and staying healthy during this unique time. So without further ado, I am proud and privileged to introduce a dear colleague of mine, Professor Corey Finn.
Hello, everybody. Some of you I've already talked to. I think Grace, I don't think I know you yet, but some of the other ones I've corresponded with a little bit. So I'm gonna go over a little bit about the ultrasound profession, give you some insight into it, and a little bit about the program, or a lot of it about the program here at Regis. So a little bit about me. So I've been in the field for pushing year 25. I did the math and figured that out recently, unfortunately. I've been teaching for almost 20. I was a clinical instructor at the Beth Israel for several years, and I have run 2 ultrasound programs prior to coming to Regis. And Jeannie and Julie were in our clinical coordinators were in programs of mine a while back, 15 plus years maybe. And then we all worked together at the Beth Israel, and we worked together at Bunker Hill Community College doing labs, and at the Beth Israel School of Ultrasound. So we have quite a lot of experience under our belt, not only in ultrasound, but in teaching. I'll let them introduce themselves. I just filled up their shoes pretty good. All right, so go ahead, Jeannie.
Let me pop off of mute. Hi guys, it's very nice to see all you tonight. So my name's Jeannie Garcia. I am one of the professors in the Diagnostic Medical Sonography program at Regis. I teach a couple different courses right now, OBGYN, fundamentals in patient care. I split with Julie as well. And then me and Julie, she'll talk about it as well, but we split the clinical coordinator position as well. I actually live up on the North Shore, and Julie lives on the South Shore, so I cover a lot of the North Shore hospitals. Julie covers a lot of the South Shore, and then we split Boston. So yeah, as Corey said, I was in her program, I think, about 14, 15 years ago. So that was at Bunker Hill. I was also a lab instructor at that Bunker Hill program. I also have prior experience as a manager up at Beverly Hospital, and I'm still currently working in the ultrasound field at BI in Boston. So it's really nice to see all you guys tonight. And now headed off to Julie, your turn.
Hey guys, thanks for being here tonight. So my name's Julie Richardson, and I teach physics, some lab, and some of just the general sonography classes. You guys will see me a lot throughout the program as well. And like Jeannie said, I will oversee some of you in clinical, depending on where you end up. And we have a lot of fun in our program. We work really well together, and it's pretty interesting field that I would highly recommend. So if anybody's still on the fence about it, do a little more research and you'll fall in love, you will. So I also I went to Bunker Hill as well, and worked at BI for years and helped with the program there that Corey directed, which was a really cool hospital-based program. But we're lucky to have her here at Regis now. And I've been a clinical instructor, and I currently work at BI in Plymouth, and a doctor's office in Quincy, and for South Shore Health, mostly at the offsite medical centers, not at South Shore Hospital, but I'm on the South Shore, so I kind of pop around to different places on the South Shore and just make sure to keep my hand in a variety of different exams so I can stay current on everything. So thank you guys for being here. I hope that you fall in love with all the information.
All right, thank you, you guys. So we have our North Shore clinical coordinator and our South Shore clinical coordinator. and then they share the Boston hospitals as well. So that's a little bit about us. I keep looking to the side because I've moved the faces over there. So we'll go through the information session. It'll be a little bit on and off script. I'm a little bit better off script, but it is worth just reading some of these things aloud. So diagnostic medical sonography, it is an imaging modality under radiology, and we use high frequency sound waves to visualize soft tissue organs and diagnose disease processes. Diagnostic medical sonography is commonly called ultrasound, and we look at the abdominal organs, the female and male reproductive system, all the organs, the pregnant uterus, superficial structures, which are your smaller organs. We'll talk about that in a minute, and all of the blood vessels that go along with these parts of your body and the vascular system itself. So what is a diagnostic medical sonographer? It is a highly specialized, nationally registered, we're registered nationally, not state, well, that's popping up a little bit here and there, healthcare professional. We perform diagnostic ultrasound exams for accurate diagnosis. We use our judgment to customize each ultrasound based on the patient's disease, the patient's body habitus, whether it's a child, whether it's an adult, whether it's a someone who weighs less than 100 pounds, someone who weighs over 100 pounds. So we have to customize each one of our exams to the patients, their body composition, and their disease process. And we have to possess and integrate a thorough understanding of patient care skills, ultrasound physics, cross-sectional anatomy and physiology, and pathophysiology. So diagnostic medical sonographers work in a variety of healthcare settings, including hospitals, outpatient imaging centers, and physicians' offices. Usually when you are a new grad, you work at the hospital more often than not at the hospital you trained at, and get about 3 to 5 years experience in those settings before you would move on maybe to maybe an outpatient clinic. There are other opportunities when you can go into the commercial side of it, where you could work for some companies, but a very small percentage of people do that. It's mostly that they're in it for the patient care component of it. And then some people like myself, Jeannie and Julie, go into teaching, whether that's at a college or whether that's in the hospital itself. The Bureau of Labor Statistics predicts that we're going to grow by 17% over the next decade. And the national mean wage, these are just the important questions everyone wants to know, of sonographers, according to the Bureau of Labor Statistics, is $76,000 nationally. In Massachusetts, it's 81 to 102 as of last year. This depends on whether you work overtime and how many years experience you have and things like that. There's usually always opportunity for overtime and extra work. So what do we look at with ultrasound? We look at way more than anyone would think at. We look at the abdomen, which includes all of your abdominal organs, such as your liver, pancreas, kidneys, great vessels, your gastrointestinal tract, gallbladder. Another area we call subspecialties, which includes the breast, the thyroid, the male reproductive system. We look at obstetrics, obviously, that's what most people identify with. We also look at gynecology, pediatrics, neurosonography, which is looking at the brain and the spine. We do this often on babies, oftentimes premature babies. We can actually put a little probe right through the fontanelle and scan in the soft spot and look at the brain of newborns. We look at muscles and tendons. That's an upcoming, it's not upcoming, it's here, part of ultrasound. We also do a lot of interventional procedures with ultrasound. It's something people might not know. So we do a lot of organ biopsies. We're in the emergency room. We're in the operating room. Intraoperative is the next one. So there's a lot of that's in ultrasound that a lot of people just really wouldn't know. One thing that, so when we talk about ultrasound, we kind of have four so main areas. We have general ultrasound, which includes abdominal and OBGYN and a lot of these topics. We have vascular ultrasound, which is looking at all the arteries and veins throughout your body. And we have cardiac ultrasound. This program is not a cardiac program. There are other ones in the state. There's one at Bunker Hill Community College and Mass College of Pharmacy. But this program does not provide cardiac training. It's its own specialty. It's almost like its own major. It's sort of like if you were to put ultrasound into the umbrella of blue collar workers, you would say that general ultrasound is an electrician and cardiac ultrasound is a plumber, okay? So a lot of people are interested in cardiac ultrasound, so you know that this is not a cardiac program. It's a different major, not offered here at Regis. And if you do cardiac ultrasound, that's all you do. Whereas when you do other areas of ultrasound, you get a variety of other things. So when I put this little point in, so when we do ultrasound, a lot of people will say, oh, well, you do the exam and the machine takes the image. And that's not the reality of what it is. It's sort of like when you're driving a car. You know the car is only going to drive as good as the person who's driving it, okay? So the ultrasound is only going to be as good as the person who's taking the images and knowing how to get the images, okay? Every time you do an ultrasound, it's like you're learning how to play an instrument, right? You start off, if you were to take a piano lesson, you'd start with chopsticks, and then eventually you could, can't see my hands here, but you could, play a nice long song. So it takes a while to get good at doing ultrasound, just like it takes a while to get good at driving a car or learning how to play an instrument. So what that means is ultrasound is very operator dependent. It's only as good as the person who's doing it. And we do the work, not the machine. So in other areas of medical imaging, it's debatable because but there's a little bit more weight on the machine doing the work versus the actual person doing the work. So the images are only as good as we take, and we give them to the radiologist, and the radiologist makes a diagnosis. We are not legally making diagnosis, but you have to remember that the images are only as good as we take. So the physicians are making diagnostic decisions based on what we provide them, which is what makes ultrasound great. So so I just want to go through a little bit area, because most people, when they think about ultrasound, they think about babies, or they think it's not as messy as nursing or things like that. So I want to make sure, for your own benefit, and I mean it sincerely, that you have a understanding of what ultrasound is. So one main area of ultrasound that we would cover here in the program is abdominal ultrasound. And that means we look at every organ in the abdominal cavity, which is down here. And some of them you can't even see here. We have kidneys in the back that you can't see here. And these vessels go all the way down your abdomen, and we look at all of those vessels as well. And what is so great about ultrasound, and of course I'm a little bit biased towards my own profession, but in lots of things in medicine, maybe with the exception of surgery, even physicians, you study something and you learn about it, and then you practice it. But with ultrasound and probably surgery, and that's probably the only two professions there are, you actually get to look at it. So that makes ultrasound really fascinating and interesting to learn, because you will learn about the gallbladder, which I have right here. Is a nice little picture of the gallbladder, and you could study that and learn about it, but then you actually get to see it. And here's a nice image of a gallbladder with the gallstone in it. All right, so we just made a diagnosis there. Here's another beautiful image of a kidney. That's a nice, you'd study that in anatomy and physiology, but then when you come to ultrasound, you get to see it. So here's a nice view of the kidney here. I know these images are hard to see, but you can sort of make out a little bit of shape here, and that's a kidney. We also have, ultrasound's not all fun and games. So here's a nice, beautiful picture of a liver. My favorite topic, as Jeannie and Julie will tell you. Could talk about the liver all day. Nice, beautiful picture of a liver. Here's a beautiful ultrasound image of a liver. But this, I'm moving you guys around because, is an image of a liver that's not normal. So see how much you've learned already? Here's a nice normal picture of a liver, and here's an abnormal picture of a liver. And these are all masses in this liver. So that is, although that's obviously a very sad thing, you are really on the front lines in ultrasound with making diagnoses for people. And a lot of times people come in, they don't know what's wrong with them, or you might even find it accidentally, and you really have an opportunity to save a life sometimes. And it's happened to Jeannie, it's happened to Julie, it's happened to myself numerous times, where you find these little itty bitty things that are just teeny tiny, and you literally save somebody's life. Subspecialty ultrasound, just another little example. Here we have a thyroid gland, and here's the thyroid gland on ultrasound. I have to just kind of take my word for it, but that's it right there. All right, these two circles here are your carotid arteries that go up the sides of your neck. And then here's a great example of diagram of a breast. And here's an ultrasound of, you can see all these different layers in the breast here, right? And here you can see a layer here, a layer here, a layer here. So we can correlate everything to these images. And this is something when you're in ultrasound school, you learn about it in the classroom, and then you do it in the lab, and then you do it in clinical. And we teach you in lab first, so when you go to clinical, you're fairly exposed already. Gynecology ultrasound, another big area, uterus, ovaries. Here's a nice picture of an ovary with follicular activity, all right? And then here's an ultrasound image of an ovary, and all these little black circles are follicles, follicular activity. Here's an image of a uterus. Be kind, I made this diagram myself for a conference I had to give a talk at, and I couldn't get it the perfect image, so I made it myself. Although it's not too fancy, it served its purpose with matching up with this. So this image right here, this is a uterus. Here's a diagram of a uterus, and you can sort of make out this area matching up these three little lines with these three little lines. And then obstetrical ultrasound, we had to throw that in, right? So here we have a picture of a baby. Everyone can see that. Here's a picture of a uterus. Here's a picture of about an 8-week pregnancy. Here's a picture of about a, I don't know, 12-week pregnancy. And that's about a 12-week pregnancy right there. And this is a little bit farther along. And when we look at this, everything with ultrasound is looking at how we look at things that are fluid and soft tissue and hardness, right? So when we look around this, the black around the baby is fluid. And this is amniotic fluid, which in case any of you didn't know is nothing but baby pee. So, and then we look, we can see the bone, and that's calcified, right? So we can see the bright areas are the baby's bone. And then these in-between areas between white and black is the soft tissue, and those are shades of gray, okay? So, and that's the foundation of all of ultrasound, is looking at fluid, soft structures, and hard structures, and all of that coming together and making diagnosis. One last slide on the types of ultrasound. This is vascular ultrasound. So we look at the arteries and veins in your neck, arms, and legs. And this is your carotid artery, a nice long neck, but goes up your neck right there. And then here's a nice diagram of what blood vessels look like going through an artery. And then again, what's cool about ultrasound, we actually get to see it. So here's the vessel, and here it is with blood flow in it. And here's a waveform of it. So this is actually each heartbeat that we can see. So you can, just a brief introduction of all the different types of ultrasound that we do, that you would get training on here at Regis. And there are other topics too, but I figure I would stop there. All right, so misconceptions about ultrasound. A big one is that we just do babies. So babies is about 10% of what a diagnostic medical sonographer does. So if you were thinking that you just wanted to come and do babies, there is no ultrasound program anywhere where you can just go and learn how to do babies. It's all of it, all right? So there are, some people eventually may just work in obstetrical ultrasound, but that's a very small percentage. And those people don't do that until probably 5 to 10 years after they've been doing ultrasound, all of ultrasound for a long time. A lot of people also think that ultrasound might be a better alternative to nursing. Either that they don't want that much patient care exposure, or they think it's easier. So I included this image that I just got yesterday from one of our graduates and one of our adjunct faculty members. So ultrasound people right now are working in the emergency room. They're working in the ICUs. We're doing a lot of those vascular studies on patients with COVID. So here's all our, one of our graduates and our adjunct professors all geared up before they go and scan the COVID patients. So, you know, a lot of people, and when I got into ultrasound when I was very young myself, so I didn't realize what it was until I got into it. So you want to know that you will be around blood, you will be around needles, you will be around the ICUs and the emergency rooms and all that. Fortunately, most of us who do that, we didn't know that going into it, but then we fall in love with it, right? And we are very patient care centered. So if you thought that, you know, you wanted to do something medical but didn't want to be around that many patients, you are not only around patients, you are extremely close to them. You are very close to them, doing lots of invasive exams on them. Some people also might think that ultrasound may be less rigorous than other medical programs, nursing or respiratory therapy, or, you know, and all of them. And that is not true. We are just as much rigorous, and we have more clinical training that we required. I don't know for sure, but I can pretty much guarantee you that we have more clinical hours than most of the other professions. And the hours are driven by the profession. They're not driven by the college. So some students are in, you know, have roommates with students that may, you know, be in another medical program. They're like, you only get to do 2 days of clinical a week, and we have to do 4 in ultrasound, or whatever it is that we have to do that semester. It's dictated by the profession. All right. So the ultrasound training requires that we do that much. Some people this is something that's coming up in recent years. It wasn't around years ago, but a lot of people think ultrasound may be more techie than patient care because it's machinery or whatever. And that's not, I mean, it is machines, you do have to learn how to use them, but it's definitely not an IT type of medical profession, okay? So if techie was something you were thinking, it might not be, it's not. And some people also say, oh, they may not be as much math or science. There's a lot of math and there's a lot of science. Ultrasound is very much based on math and ultrasound physics and anatomy and physiology. So you really need to know if those are topics that you struggle in, you know, just say, do I struggle in it because I don't put as much time in as I should, or do I really struggle with in its torture for me? And only you know the answer to that. But know that we are very much based in math, physics, and science. Fortunately, it's ultrasound physics, which is a little applicable because it's how the machine works. And we'll talk about this in a second. I'm gonna, for the sake of time, I'm gonna continue, and then I'm gonna let Julie talk about some of the math and physics, because she is our math and physics extraordinaire. So specifically for Regis, so some of that information was just about the profession itself and what a sonographer is, okay? And anything I just said applies to most ultrasound programs in this area. So the clinical's the same rigor everywhere else. So a lot of everything I just said, again, that's unique to the ultrasound profession, okay? Now the program at Regis, what you will get is a bachelor's degree in science. You will receive a bachelor's degree in science and diagnostic medical sonography upon completion. The sonography program is accredited by CAHEP. And I put this slide in a lot, my years of experience, a lot of specifically transfer students or maybe parents. Over the years, I've had a lot of questions about accreditation. So there is a difference between the college being accredited and the program being accredited, okay? Regis is both. The college is accredited, or they wouldn't be running any programs, and then the program is also accredited. And the agency that accredits ultrasound program is called CAHEP. It is the commission. I have to test myself every now and then. It's the Commission on Accreditation of Allied Health Educational Programs. But it's not that simple. There has to be a middleman, right? And the middleman is the Joint Review Committee on Diagnostic Medical Sonography. Why am I sharing that with you? I'm sharing that with you because this part right here, the JRC DMS, I work with them. I am a visitor. We call these the school police. So I go around to schools, audit schools around the country to make sure they're following the standards and guidelines, all right? So if that gives you a sense of security, that we know what we're doing at Regis, we do. Because I implement these rules and we're rewriting some of them. I love it. I can't get enough of it. So we run a really good program here, okay? And program prerequisites. And these, if you have questions about admissions in the core education, we have people you can ask those questions to. I am specific with the program prerequisites, okay? So for all ultrasound programs, it doesn't matter where you go to school. It's an accreditation issue. You have to have anatomy and physiology 1 and 2 with the lab. You have to have a physics course as a prereq. It could be a general physics course. It could be a health science for physics. There's a lot of wiggle room with that. We have to have college algebra or higher math. And we have to have, those are program, we also have to have English. And if you are a transfer student, and we could talk about this separately, you will have to have statistics, and most of you already have a statistics course done already. We're making some changes for the freshman course. Math is really important, and we can't teach math in the ultrasound program, all right? So all of these courses, you have to get a B- or higher. And we do lots of tutoring. If ever you're on the, if you're teetering on a B and a C, we set you up for tutoring right away, and Regis has excellent tutoring services for that. We also, for the incoming freshmen, there's going to be, and I'll provide more information later on, a 2-week pre-algebra boot camp before you start college algebra in the fall. And this is online. It doesn't cost anything. I believe it's at your pace, but it's only like 2 weeks. And it's just to make sure that your pre-algebra skills are up to par before you take algebra, because we don't want to have you really struggling once you get in here. And I'll provide more information on that later on. The curriculum, if you are an incoming freshman, the first year is a lot of your prerequisite work and your core curriculum. And your core curriculum is a set of courses that every student at Regis has to take. All right, and we have a prescribed curriculum where we tell you what classes you need to take so you don't fall off track and take too many courses or too little courses. The short version of the rest of the program is the second year you finish your core curriculum and you start your ultrasound courses as well. And this is the same for transfer students, right? You finish up some core classes and you start ultrasound courses. The third and fourth year of the program is mostly ultrasound courses in clinical. Important things you need to remember, and this is profession driven, not Regis driven. This is the same at any other school. Ultrasound training is continuous. So when you start your ultrasound training, you don't stop. So what that means is you go to clinical over the winter sessions. You get, a couple of weeks off for Christmas or whatever, a spring break or whatever. The summer in between your junior and senior year, you go to clinical during that summer. And that is standard for any program nationwide. You don't, but if you look at other medical programs, like say, I could be wrong, but maybe, well, I don't know. Let's say maybe it's nursing. They may have the summer off, then they can do their clinical again in the fall. That doesn't happen with us because you're learning a skill set that's hand-eye coordination. So there's no ultrasound programs where you have a break from training. Some of the other ones, some other programs, there may be, you get the summers off or winter breaks or whatever. So it's important that you know that clinical goes in the winter sessions and it goes in the summer sessions. And this is also demanded by our clinical sites. So the clinical sites will not take students if they have 6 weeks off, because that just doesn't make any sense to the profession. So, and again, profession driven, not Regis driven. All right. Some of our clinical sites, all right, We have all of these sites. We have Mass General, we have Boston Medical, Brigham and Women's, Leahy Clinic, Beverly Hospital, North Shore Medical Center, South Shore Medical Center, Lawrence Memorial Hospital, St. Elizabeth's, Good Samaritan in Brockton, Holy Family, Parkland Medical, and then all of these other ones that have asterisks. We use these sites sometimes like every other year. They take students from other schools as well, and sometimes they like to rotate, so they're taking students from all of the schools, which is good, and that's fair for the hospitals to share their sites with all of the schools. So it's not every single year we're sending students to these ones, but they're in the mix. And one thing that's really unique about Regis, and I say this from a very proud and heartfelt, warm, fuzzy place, is that a lot of people who work at these hospitals, and when I say work, I mean they are the managers and they are the clinical instructors. A lot of them were in some of the programs I taught at over the years, and a lot of them just coincidentally happened to be in Jeannie and Julie's classes as well. So there is a great sense of community that you get with this program, with the faculty here, that I think is unique to us. All of the other ultrasound programs in the area are fine, but I think that, you know, that is something that's really unique about our program, is that they trust myself, the hospitals trust myself and Jeannie and Julie, because we all almost grew up in the field together, and they all know how we teach, and because they were taught that way. So that's a really, I can't express enough how beneficial that is for our students. And I'm just gonna let Jeannie and then maybe Julie will jump in a little bit just to talk about a little bit more of the clinical, how we follow you when you go to clinical.
Yep, perfect. Yeah, so I'll start. So as Corey just said, we have this great rapport with all of our clinical sites. All of your clinical instructors that you'll work with, we work very closely with them. It's very important that we are on top of these things, and we're making sure that you are progressing through this program. What myself and Julie do, and Corey will come out for site visits as well. We come to check and see how you are doing in your clinical sites. We come out, we look at your exams. We're able to see the variety of exams that you're doing, and how you're progressing throughout each of the semesters. There are competencies that you will have to meet for accreditation purposes, for your own purposes. So we need to make sure that you are meeting those each semester. If there's any issues, we have that great rapport with those clinical instructors that we can kind of get on top of those things and help you out, give you extra scanning time, help you in the lab if necessary. That's one of the things that's great about this program, and not to boast, but us working together, being able to bounce different ideas off of each other. We want to see you guys come to this program and succeed in this program. We don't want any failure. So we work really closely with tutoring services. If you guys are struggling, we're on top of that. And Regis has great, like Corey said, tutoring services that we can refer you to so that you don't fall through the cracks and things like that. Yeah, so that's what we do for clinical. Did you want to add something to it, Julie, or maybe some of like the math stuff that you kind of oversee?
Yeah, I'll speak to the math a little bit more. So Corey talked about the prerequisites, and I feel like it may seem a little rigorous at first glance. You may, even as a transfer student, end up needing to take another math course, and that's really just to make sure that you're all set when you hit physics with me. So unfortunately, we just don't have time to go back and teach math and bring it to the front of your mind. So we want that kind of already front and center when you get into physics, which will just help you glide right through all of the equations and fractions, decimals, all the things that you're not doing on the day-to-day before you hit the ultrasound world. A lot of people think that physics is something that you can just kind of study to pass your boards, but every button that you press is really physics. It's physics at work. We're taking sound waves, we're bringing sound waves, you know, into a patient's body, and it's our job to manipulate those sound waves in a way that makes an appropriate display of a person's anatomy so that the doctor can create or can diagnose the patient accurately. That's really what we're doing. So everything that we do really in physics is applicable because you're using it every day, whether, you know, every sonographer probably doesn't think of it that way when they're at work, but that's what we're doing with every button that we press. So having a solid math base is imperative. And that's one of the reasons we're doing this boot camp, is to get you ready for your algebra class. And then from there, if there's any issues that come up, like Corey and Jeannie both said, the tutoring services are amazing. You have an amazing support system at Regis, and we will not, you know, will not let anybody fall through the cracks. That's why we're kind of rigorous with this. So we'll make sure that everybody's where they should be before they get into the physics class. And then it's not a breeze. It's definitely a tough course load in ultrasound, just like any other medical program that you get into, but it is well worth it. It's well worth the work.
Well said, ladies. One other thing, I know this is always a burning question with the clinical. Oftentimes people want to know where are they gonna go. And all I can say is we're not going to send someone who lives in Cape Cod to New Hampshire. We're not going to send someone who lives in Lowell to the South Shore. So we try and be geographically sensitive. But I look at all of these clinical sites equally. They all offer something unique. Some may have less volume, but you get more individual attention. Some may have more volume, but you're expected to hit the ground running day one. They all have strengths and weaknesses, just like we all have strengths and weaknesses as humans. So we really try and match up where the best fit for you is going to be. Where based on, once we get to know you, how you learn. You know, some people need to hear something 3 times. I'm one of them. It sinks in on the 3rd time for me. Some clinical instructors are okay with that. Some are going to tell you once and expect you to know it. So we really, and I think we do a really good job at making sure that we match up your needs as a student to the best clinical site for you, and vice versa. So it's definitely not that the best students go to the Boston hospitals. I look at all of these hospitals equally, all offering different things. Honestly, some of the community hospitals have a better variety these days because the bigger hospital things are separating out. You usually go to 1, possibly 2 clinical sites. Sometimes we have to, and it seems like we're having to do that with the Boston hospitals because they're so specialized now that we have to make up for equal exposure. So sometimes we're pairing up a bigger hospital with the smaller hospital to get the exposure that the smaller hospital offers. So it's pretty much, you'll have one base, and either that's the only place you'll go, or you may have somewhere else where you rotate depending on what's going on. But you won't be going to a different hospital every 6 weeks or something like that. Ultrasound is very, other things we look for, it is very patient care centered. It is, you know, so we really want to know that you are gonna, you know, you're gonna be working with older people, sick people, people that don't look like you, people who don't smell like you, people who are in wheelchairs and stretchers, you know, so that, and that's what makes ultrasound great. So, but we have to know, we look for a strong patient care component. You have to have a strong work ethic. When you go to clinical, your hours are like 8 to 4:30 every day. And believe me, it's 8 to 4:30. There's no leaving early. Again, that's profession driven. There's no school where students can take off early in ultrasound. It just isn't tolerated in the field of ultrasound. I don't know if I can't speak for any other program, but just know if you're doing 8 to 4:30, those are your hours. And a lot of this stuff we've already talked, you're going to work in a variety of different demographics, and you have to have an extensive knowledge of anatomy and physiology. We're getting towards the end, and then I can repeat anything for anyone who came in late. So we are registered nationally through the American Registry of diagnostic medical sonography. When you graduate, you have to take 3, arguably 4 board exams. We don't, ultrasound can't be simple. It's not one exam. Like nursing has that one exam they take. We have about 4 to 5. There's a reason why myself and Jeannie and Julie have many initials after our name. It's because we had to pass all of those areas. When I went through those areas of ultrasound, there is a registry exam for every one of them. And every one of them has the rigor of, they're not, we definitely prepare you and prepare you well for those exams. So that won't be an issue. Our societies, which are different than registries, we have the Society of Diagnostic Medical Sonography and the Society of Vascular Ultrasound, and those are good resources for you to look at. And then if you have any admissions questions, and Laura and Vicky are here, and other people from admissions as well, you can always ask me, but I will defer to them. I know what I know, and I know what I don't know as well. If you have ultrasound questions or prereq specific for ultrasound, I'm your person. But any questions about admissions or core curriculum, I would refer you to admissions. But you can always, I have open door policy. You can email me whenever you want with any question you want. And if I can't answer it, I can steer you in the right direction. And if you email me and I haven't responded, you can feel free to email me again.
Thank you, Professor Finn. At this time, I would like to open up the floor to any questions that anybody may have. And you're welcome to unmute yourself, or if you want to put it in the chat box, that is fine too. Although it is also very possible that you answered everybody's questions in your comprehensive presentation.
Yeah, I know the questions that are coming, so
I know, it's great.
We're pretty well versed at answering them.
No, that's wonderful.
There's a fine balance between you don't want to intimidate, but you want to answer all the questions too.
That's great. Well, as it looks like there aren't any questions, certainly you have our email addresses up on this screen. We welcome you to reach out to us well after this session if you do have questions. For those of you who are actively applying or who have been accepted, please make sure you're staying in regular communication with your enrollment officer about deadlines and capacities. This program does have a capacity, so we want to make sure you have all your questions answered. If you need any help accessing financial aid or any other office on campus, please reach out. We're always happy to assist and be a resource for you. I would again like to thank you all for joining us this evening. I hope everybody continues to take good care. For those of you who are preparing for graduations, whether that is from high school or your community colleges, congratulations to you on your upcoming commencements. Although it feels a little different, it may look a little different, everybody is no less proud of how great and how hard everybody has worked in 2020 and well before 2020 and beyond. So thank you again. Thank you everybody for joining us this evening. To our esteemed faculty and my colleagues, thank you for this wonderful overview, and we wish everybody well. Take care, everybody.
If you want to, if anybody came late and they want me to go over some stuff at the beginning, if you want to share me, I'll go over it with people. I don't mind.
Great. Thank you very much. Thank you, everybody. Have a great evening.
Thank you.
Thank you.